Hello and welcome to this Spotlight on Radiation Therapy for Massachusetts College of Pharmacy and Health Sciences. My name is Tim Ryan and I am an Assistant Director of Admission at MCPHS. I'm joined today by a faculty member and a student from our radiation therapy program. And I've got some questions that I will ask them, and hopefully they'll give a little bit of information that will help you to see what it's like to be a student in the radiation therapy program. So I'm joined today by Professor Kelly Ebert and by a student, Tylana Laurie, and I'll have each of them introduce themselves, starting with you, Kelly.
Hi, Tim. Thanks so much. And I just want to congratulate everyone on being accepted into MCPHS. I think that's a great accomplishment, and hopefully we can do something to make your decision a little bit easier. So as Tim said, my name is Kelly Ebert, and I am the director of the radiation therapy program. I'm also an associate professor at MCPHS. So I'm going to throw it over to Tylana.
Hi, my name is Tylana Laurie, and I'm a second-year radiation therapy student. And I am, a little bit about me is I am 30 minutes outside of Boston, which is 30 minutes away from MCPHS. So I'm in a great location.
Excellent. Well, thanks very much to you both again for joining us. We'll get right into the questions. The first question for you, Kelly. Can you please describe the strengths of the radiation therapy program and the things that make it the best choice for students?
Sure, I'd love to. When I think about the strengths of the program, there's a couple of things that instantly come to mind. The first of which is the location of MCPHS, because we reside in the Longwood medical area and we're surrounded by just world-class hospitals and clinical settings like the Beth Israel and the Brigham and Women's and Mass General and so on and so forth. There's so many of them. And so the opportunity for our students to rotate at those clinical settings is really second to none. So that's certainly a big strength of our program. And secondly, one of kind of my favorite things about the program is just the small class size. We end up having such a small group of students that we can really get to know each other and really kind of become a family by the time students actually get through the program.
Awesome. First question for you, Tylana. Can you tell us why you chose MCPHS?
As well as what Kelly said, I chose MCPHS because it's location. I do say to people that I talk to that MCPHS is surrounded by the top hospitals in the country, and then you can arguably say the world. So the location was very much why I chose MCPHS, and also I'm surrounded by many opportunities and I think after graduation opportunities as well.
Awesome. Kelly, can you tell us what you enjoy most about teaching at MCPHS?
Sure. There's a lot that I really enjoy about teaching at MCPHS. The one thing comes to mind is the nature of the university is to be very student-centered and very student-focused. And I really enjoy that aspect of teaching. There are so many support services for students, like there's CASE and there's peer mentoring and there's tutoring services, there's different support services that also for me as an instructor help support me in what I do. I understand as a faculty member that I'm not the be all end all of the knowledge base. And sometimes someone else needs to try to relay the information to the student in a way maybe that I'm not doing very well. So we work together to give the student the best education that we possibly can. I also would like to note that since all of the quarantine and the COVID-19 has become so prevalent in our society, I think that MCPHS has responded in a way that makes me incredibly proud to be affiliated with the institution, and especially as it relates to teaching. Anything that I have needed in order to help my students through this really difficult, really trying time for all of us has been met with nothing but support. So those are just some of the things that that I would say I enjoy most about teaching here.
Excellent. Thank you. Tylana, next question for you. Can you share some examples of how the radiation therapy program has prepared you for a career in healthcare?
Yes. So the classes I take and the courses I take, I should say, really do help me prepare for the future, my future, and graduation. All the courses I take are really centered and geared to what I will be doing in my field, and I'm not taking anything out of the ordinary, I would per se, and I like to say every little bit I learn, I will be putting into the field. So even like small as a math equation, adding, subtracting, I will be doing that in my field all the time. And everything is all centered around when I graduate and when I'm out in the field.
Excellent. Thank you. Kelly, can you provide some examples of accomplishments, appointments, or accolades for the faculty within the radiation therapy program?
Sure, I'd love to. Love to take a minute to brag a little bit. The radiation therapy program is really fortunate to have some really stellar adjunct professors that work with us. We have 3 individuals who work for Harvard that do some teaching in our physics area, in our treatment planning area. And then the program itself is run by myself, and I work with someone named Janki Patel, who is our clinical coordinator. And one of the really cool things about Janki, and there's many, but one is particularly is that Janki is still working in the field. She does some per diem work at a hospital that's in the greater Boston area. So in terms of her being able to work directly with the students regarding what they're doing clinically, she's perfect for that because she's out treating patients still. So Janki also holds an MBA and has years and years of experience as a therapist in the field. As far as me, I recently have had a promotion in rank at MCPHS, so I'm now an associate professor. And along with that has come a lot of kind of hoops that you have to jump through. And part of that is kind of staying present and staying up to date with the technology and in the ever-changing field of radiation therapy. And one of the ways that I do that, and Janki does that as well, is we do some speaking engagements around the country, and we do some publications within the field. And we're both pretty proud of our accomplishments on that front.
Great. So Tylana, you're in year 2 of an accelerated program, so I'm sure it's already time to start thinking about what's next after your program is over. Can you tell us about either your plans or your goals for after graduation?
Yeah, so just to elaborate a little bit more, it is a 3-year program, so I will be getting out much earlier than other people or other students in the field, so that is a big plus. And after graduation, I like to say I kind of will go where it leads me. But I was thinking about staying in Boston a little bit, as well as I heard that maybe I will get a job at where my clinical site is. So hopes that will go well. Or if I decide to venture off or out of Boston or out of Massachusetts, I will be looking to out of state places as well.
Tons of opportunities for sure, especially with all of the hands-on experience that you're getting while you're in the program. So that's great. Next question for you, Kelly. Are there any tracks or additional opportunities that students should consider if they're going into this radiation therapy program?
Yeah, there are. In terms of radiation therapy specifically, our bachelor's degree in radiation therapy is what we would consider to be the terminal degree in radiation therapy specifically. But I'm a big advocate of education and of lifelong learning. So if a student wants to pursue more education within the field, NCPHS has a certificate in CT imaging, which is computed tomography. which would help them in the clinical setting a great deal. That's technology that we use as therapists all the time. And then MCP has a plethora of master's programs that students could look into to pursue their education if they want to perhaps go into administration or management or something like that within the radiation oncology world.
Excellent. Tailana, can you talk a little bit about your activities outside of the classroom? So whether it's volunteer, internship experience, or other things that you're doing with the university?
Yes. So because of COVID-19, most of my outside activities are online and virtual, but I am a part of the Brain Cell program, which works directly with admissions, and it basically is a leadership program that helps students and essentially lets students know of the opportunities and helps them around campus and different things like that. So I am doing the Brain Cell program.
Awesome. Wonderful. Next question, or last question, I should say, for you, Kelly. Can you share some examples of some outcomes that students can expect to see after they finish the radiation therapy program?
Sure. One of the outcomes that students love to hear about is, are they going to be able to get a job? And we do a lot of tracking of job placement. And for the past 5 years, I think only 1 year have we not had 100% job placement rate. Most of our students end up getting employed through their clinical experience while they're in the program. It's really common for students to be offered positions with the sites where they've been rotating. So that's exciting. It's very, very much kind of like on the job training. So then they're ready because they understand how the organization works and they're ready to just kind of hit the ground running with their employment. We also have a kind of an interesting little side note is that there is a very well-known hospital in Boston that I won't name, but they don't allow our students to rotate there. However, they have been the biggest employer in the radiation therapy program at MCPHS University for as long as I've been here. So I think that's kind of interesting that another school actually rotates through their hospital, but they hire a lot of our graduates. So I think that says a lot about our program and our institution.
Definitely does. Thank you very much. And last question for you, Tailana. Any bit of advice that you can offer to our accepted students who might be currently watching this presentation?
Yeah. So advice I would give always is do whatever makes you happy and do it at 100%. And always try to reach for your goal. And I know that sounds cliche, but if you really want to do something, just go for it. And also, I would add if you, a lot of students do struggle and sometimes it does get tough, but as well, MCPHS offers a lot of programs and helping students. I like to add such as the Writing Center, we have Math and Physics Center, and then we also have CASE, which helps students get a tutor, and this is all for free, so that is a big plus. So I like to say if you are struggling and need help, MCPHS is there to help students, and they're not there to see students fail. So if you have any questions or any, like if you're struggling in classes, you can always reach out to anybody and they will always lead you in the right direction. So I would say ask for help and always push for your goals.
Awesome. Yeah, that's very true. All those resources for both in-class assistance, but also anything really that you're facing. And your point about us not wanting to see students fail is a really good one. We really do love to see our students succeed. And so hopefully we've given you some idea of what it's like to be a student in our radiation therapy program. That's all the questions that we have today. I do want to thank both Tailana Lurie and Professor Kelly Ebert for their time today. And I want to thank you for your time and attention in watching this spotlight on radiation therapy. If you do have any questions, we'd be more than happy to answer. Please feel free to reach out to admissions@mcphs.edu or to your admission counselor if you have any questions. Thanks so much and have a great day.
Thank you.